So let's get back. Why I'm asking is that let's say also for the so-called prospective students who would like to come to Germany, study, how was it? What was your preparation like when you applied for your PhD? Was it the first PhD that you applied for and the only one, or you applied for other countries, or your destination was always Germany because of certain other things which you explained before as well? What was it gone in the whole preparation? Because we also know that you have been DAD Young Ambassador as well. So how was it like, so that if you can give a bit of let's say, I would not say advice, but something that people can look upon, say something they have to be following, those kind of things, that if they want to apply for especially institutions in Germany, what is expected?
Right. Yes, this is, I would say, in retrospect, the journey of applying to PhD in retrospect now started when I was in the third year. This was a time I got a chance to present one of my papers at the International Conference for Inborn Errors of Metabolism in New Delhi. And this is where doctors and scientists from about 15 or 18 different countries were present. And one of them was Professor Dr. Anip Das, my mentor here,
Right.
my PhD supervisor, Dr. Fata. He was present at the conference. He also gave a talk. I had a very good chance to interact with him over 3 days. I actually, this was also some advice from my parents, which I believe was very, very nice till today. That they told me I should carry copies of my CV and my publication, so that if I meet someone,
One.
I can actually give it to them and I can interact with them. If I can do a clinical elective, because Manipal was allowing every student to do 1 month of clinical elective in the final year. So this was also one of the aims of going to the conference, other than presenting my paper.
Right.
And I was very fortunate to meet Professor Das in the conference. He was very nice. Over the 3 days, we had a lot of discussions. He saw that I could also speak German, and on his return back to Germany, I immediately, when I emailed him, I got a response that yes, I could do a clinical elective. And this is where the journey started. So about 7-8 months later, I came to do a clinical elective in January, February next year in 2014. So the conference was in 2013 and I came here in 2014. And I had a fantastic time in the department of Professor Das for 1 month. And this is when actually he even sort of offered me that I could do a PhD after my MBBS was completed in his department. So I kept in contact with him over the next 2 years. And then we again met in 2015 when I had come to Munich. We discussed about what projects were feasible. He arranged funding for me, and this is how we worked towards getting my admission in PhD. Now, what was important in this? There are definitely a few points important for every candidate, and I'm sure the list will be bigger when other people who have also done a PhD in Germany can add to this. Firstly, building network. So, contacting professors is extremely important. If it can be done in person, that's wonderful, but it may not always be possible. So, we have email, we have LinkedIn, we have several platforms which are available. I would really encourage people, and this applies, I think, to any discipline. It's not only medicine, it may apply to engineering or the natural sciences like physics, chemistry, biology, biotechnology, for example. Please attend conferences. This is one thing I would really say. Attend good international conferences, because that is the place where people will come of those field that you are interested in. And this is something, an excellent networking opportunity. Secondly, don't be shy of contacting professors. A lot of time we hold ourselves back. So something that I mentioned in the Nobel laureate meeting, that I was myself, I had inhibitions as to how to talk to Nobel. A lot of us go through, especially as undergraduate students. So it's nice not to have these inhibitions. Talk politely, talk nicely, and this will go a long way. Um, Being very professional. Uh, there are people who don't have professional email IDs, and this is a big factor when it comes to applications. So for example, if an application is sent by the name of, if it's XYZ underscore rocks something something at gmail.com, the professor is very less likely to read this email, because firstly it might go into spam, and secondly, they don't think that the candidate is serious. And also, while starting the emails, they should be directed specifically to each professor. Instead of writing just dear sir or dear ma'am or hello or something like this, it should be dear professor doctor, so on and so forth. And then of course, the core part, I mean the core competencies, the science behind it, one's profile should be good. It's always competitive today, it's getting more and more competitive by the day, I would say. So that the core aspect should all be in order. Having good references is very important. This is also something that I found in my journey, and this was the only PhD application I actually made, because I really wanted to do this. And I didn't even apply for the entrance exams in India to do MD or MS. So I would suggest people, if they are convinced with the path they're going, and if it is doable, stick to it. It can take some time, but things will happen.
Okay, I think that's a word. Wonderful. Very, very interesting. And thanks for those points. It's, I think, probably prospective students, it will be helpful.